and pressure ulcer care at the same time is very, very, very important, because you might have seen in your hospital settings also, once the pressure sore is developed, it takes a lot of time for a person to get out of the hospital. Okay, and at times the relatives also put the blame on the care aspect of the hospital. That is, they might not be caring at home also, but then when they come to the hospital, people expect that we have brought the patient to the hospital. They should not be developing the other things rather than what they have been brought the patient with, the complaints. Okay, so we'll be focusing on the grooming and hygiene and skincare and pressure ulcers. There are other aspects also. You can go through all these things which are other needs of the person who is the bedbound. But currently in this Ishanvi Devi, she is the mannequin's name is Ishanvi Devi. We have kept. Sir might have told you also. So उनकी कहानी वहाँ लिखी हुई है. So we are. She is my. She will be helping me. She is Major Jibila. She is my resident, and she is also doing MSc in cardiothoracic nursing here. So she will be demonstrating how we can provide the basic nursing, like how we can take care of the grooming and the hygiene of the person, and how to provide the skin care. Okay.
So first and most of the care, what you think, what we need to give to the patient? One of the care, what all aspect we need to look at with the patient?
Proper dressing.
Yes, proper dressing in case of any wound.
Hygiene.
Hygiene is important. First and most of hygiene is oral care. We need to do the oral care. So in the like this is moderate fidelity mannequin. So we can, like in the mouth care, we need to tell the patient and the caregiver. So we need to properly educate the caregiver first and almost. Then we'll get the confidence. So we can tell them, most of the elderly patients, in most of the cases they may bite also. So we should not put our finger to take care of the mouth. So we can use, like if they don't have anything in the mouth, in the home, they can use it, but according to the patient condition. Others we can use an artery forceps and we can roll, like we can grab the.
It may depend upon the consciousness of the patient.
Yes.
If the person is conscious, you can always give them brush, and you can give them a bowl and with water, and they can brush their teeth, or you can assist them in brushing their teeth, and you can do the oral care.
So gag is very important. Gag
But-
reflex very important.
Yeah. But then the patient is on rice, 2 feedings, at that time, or patient is unconscious, the oral care has to be taken care of, because most of the microorganisms are being present there, and then they will again lead to the other issues in the person. So that is also at most importance here. So in the unconscious patients, we have to take the help of the other aids, which can help us in providing the oral care to the person. So like she is telling about, कि हम घर पे we can use the chlorhexidine solution is coming for oral care, that we can use.
If the patient is able to spit it out, we can use that. Otherwise, if they are not able to brush their teeth, so we can use a gauze with an artery forceps and all, and we can do the. So before telling the care, we need to tell first. We need to take care of the dentures. If patient is having dentures, we can remove the dentures, and we will tell them how to clean the dentures. We can use the normal paste and brush to clean the dentures. And in case of we are giving the care to the patient, so we need to take care of the incisions first, like the most sterile part to the least sterile part. We need to take care of the upper part of the teeth, and we can go to the lower part. Then we need to take care of the gums and teeth, tongue also. So we can tell them to we can pour the fluorescent mouthwash with the bowl. Take this, and we need to remove the excess solution, because it can lead to aspiration. So we will use it. Like this, we'll dip it and we'll use it, and we'll tell. If the patient is conscious, we'll explain the procedure to the patient, and we'll like this. We'll do from here, starting question, and we'll go down, and we'll discard this, and we'll take the other gauze, and we'll do from starting to the lower side, and we'll take care of the gums also, both the gums and the tongue and the upper part also, and we can discard this. If the patient is conscious, before that we need to provide proper, we need to up the bed. It may again lead to aspiration, so we'll provide the towel over here, and we'll start the procedure. Okay.
But also in the home settings, in the home settings, they won't be having the forceps and all. So what we can tell them is, they can wrap the gauze piece in a finger. Okay, and they can wrap it and then we will put it into the solution, and with that also they can do the cleaning. Okay, that is also.
Don't do it in an agitated patient.
They can bite. Okay, it is like for the unconscious patient that can be done, and the patient who are not real, who are having dentures and all, or who doesn't want to put dentures but then they want assistance in cleaning their mouth. That time we can use with the help of the fingers also we can do. Then come after the oral care, face wash and everything is very much important, especially the eye care and all, because they may have a dryness of the eye. Now, so we have to do the CNC is there that we can put.
We can dip the cotton in a normal water and we can clean the eye inner canvas to the outer canvas. Then we need instill the medication.
So cleaning of the eye and this one, and plus after that we have to come down. When we come down, we have to basically take utmost care of the folds, like breast vein, then axillary folds and everything, because these are the areas which are mostly left out. So it has to be taken care of.
Mostly the fold like ear fold, then comes the like the nipple area, below under the nipple, and the fold of this abdomen also. Then a lax skin fold, so we need to take care of the abdomen also. Then the pubic area and the digital interdigital aspects also we need to take care. So we can tell the caregivers to, like, we can fold the towel like this. Mostly the patient normally uses the wipes, but we can tell them you should use the soap and water. With lukewarm water, we can take 47 degrees. So we can use the lukewarm water after checking the temperature and tolerance of the patient. We can fold the towel like this. We can dip in the soap solution, and we need to start. We have already done the skin care. So we'll explain the procedure first, and we'll do like this gently, and we can use like the fold. We need to take care of this. And the neck also prone to get the infection. So we need to first switch off the fan, maintain the temperature of the room, and we need to privacy. Whatever part we are doing, we will expose that part only.
Important. Whether the patient is conscious or unconscious, we have to keep in mind the privacy of the person. Okay, like this we are demonstrating here in front of you, that's why we have not kept the screen and all. Otherwise, in the ward setting, in the clinical settings where many of the patients are there, many geriatric cases are there, we can, and then we have to place the screens, or if they have individualized beds, like in ICU care settings and all, we have a curtain all around the patient. So that has to be drawn, then only we are supposed to provide this type of care. Whether conscious, unconscious, irrespective of that, we are supposed to take care of the privacy of the person. So that is also very, because we have to maintain the dignity. That is also important. It is not that the person is old so they don't have a dignity. It has to be taken care of. It also boosts up the confidence of the person, and it also helps them to come out of their illnesses and all. Okay, so that is important.
And all of them will loving, like if they feel good, like if they appear good, they feel like we need to start from the upper part of the body, and we'll do the like hands from the proximal distant to the proximal part. We'll leave the axilla now, and we'll do the next part also. We'll do the chest cleaning and cover the patient in the upper part. Like we'll put the towel over here, and we'll come to the lower part. After like we'll do till here, and we'll do the like we'll expose the legs, and we'll do the carrying from the proximal to the distant to the proximal. After that, we'll take care of the pubic area and the armpit. So the fold we need to take care of that.
And this perineal care is also very important. If a female patient is there, that time perineal care is also a very much important. So that has also to be, that also needs to be taken care of.
So you can take a separate towel for that, to take care of that part.
And also patient with urinary catheter in situ, they also need perineal care, so that infection can be prevented. And for the patients who are on for for the male patients also, the catheter also need to be changed in how many days?
2 weeks.
Yes. And if the silicone catheter is there, there are various type of catheters nowadays. Yeah. Foley's catheter is there, which is normally we are using in our OPDs and every time. There are silicone catheters for long-term use, which we are using. Okay, and then if there is a further requirement, or there is a problem with the prostate aspect, or if any urinary bladder problems are there, then we make a cystostomy we do.
Yes.
So that is also there, and SPC can be there. Suprapubic catheterization can also be there. That has also been mentioned here. So that can also be there. There is a यहाँ पे इसके there is a
And
model also.
and
SPC
most
के
of the
लिए.
patients will be
This
having like
mannequin is like androgynous, तो इसमें सब चीजें हैं हमारे पास. तो इसमें cystostomy का बना हुआ है. We can do catheterization also in this one. Right now I'm not showing into all those things. Then there are stomas also. Colostomy can also be there for these. In old days, if the person is having some sort of bowel obstruction, that time colostomy can also be there. So that also needs to be taught to the caregivers, as well as when till the time person is with us in the hospital, we are supposed to take care of these areas also. Along with that, another portion which is of very much importance is the pressure ulcers. Okay, well, because pressure ulcers there are various grades also. We have displayed over there.
so we'll tell the caregiver how to take care of the back. So they need to sponge daily the back area also. Like as I said in the front portion, you need to take care of the back portion also. And like we will tell them after having food, after 2 hours only, we'll do the positioning of the patient. So we need to after to prevent the bed sore, what all we need to do? Like
Change position.
And
How we can
let's
do?
expect we'll tell them to procure a alpha mattress need to.
There are alpha mattress, there are what air mattress.
Air mattress.
And then that can be used because it evenly distributes the pressure and relieves it. Helps in the prevention of bed sores or decubitus ulcer also we call it, or pressure ulcers. Okay, so that is also to be taken care of. And positioning, that is of utmost importance, that needs to be taught when we need to, especially in a case of unconscious patients or bed-bound cases. They might be conscious but bed-bound, especially like fracture, fracture of femur and all those cases. They
Stroke
need to be taught about how to do the positioning with the support. So till the time person is in the hospital with the caregiver, also we are supposed to take them along when we are providing care to the patient, so that they also learn at the same time that yes, it is possible at the home settings also. We have to prepare the patient to go home also. No? We cannot keep the person for a long-term care continuously in the hospital. And we have to send them to the home also. So we are supposed to teach them so that they can take care of the person in the home settings also. Like how to provide care is.
So fall prevention is also important. So we need to put out the railings and stable the turn. So we'll fold the leg and we'll turn to that side.
ऐसा नहीं है कि ऑक्सीजन अगर लगा हुआ तो निकाल देना चाहिए, ठीक है? It is just because I have to cross this area.
So every 2 hours we need to
You
change
have
the
to
position.
put the hands like this and then
Fold the leg.
इसको
So alpha mattress is on.
we have to
Turn the patient
turn
like this.
patient as a log in one go,
We'll
and then
expose whatever
we
part
have
we
to
need.
expose the back, and you have to look for the areas which are prone to get ulcers, and those are point like कौन से होते हैं वो points?
Sacral area.
Sacral,
Scapular.
Occiput.
Occiput.
Scapular
देखिए
area.
ऊपर से शुरू
Yes.
करें, हाँ तो वहाँ से शुरू करो occiput से,
Occiput.
फिर
Scapular.
scapular, yes,
Sacral.
sacrum,
Heels. Ankles.
yeah.
Heels and ankles.
So we are supposed, so when we provide the bed bath to a patient, that time itself we get a chance to observe. And after that, every 2 hourly is essential to change the position of the patient. हम भी बहुत देर तक लेटे रहते हैं तो हमें भी दर्द होने लग जाता है. So they might not be able to tell you, but then they might be facing problem, है ना?
And we'll tell them some of the massaging technique, like the stroking will enhance the blood flow. So we can do the stroking. Then we can do this in effleurage method. We can fold the skin like this. See? Like this.
You can come this side.
Then again we'll stroke it, and we can do the support method. Tapping. Tapping. Like this we can do the tapping, so that the most of the patient will be having respiratory problem also, so it will enhance the cough to get out. Right? We can do that. Again we'll do stroking, then an effleurage like this, and we can do the love look at it like this, ironing, good ironing. So we can tell the caregivers, we can teach them this all
At the
technique.
same time, we can tell them, अच्छा अभी करके दिखाओ एक बार, आप भी करके एक बार देखो, because they are afraid of touching the patient कि कुछ हो ना जाए.
Could
So
you-
we should make them do it in front of us. So then they also participate. One of you can also do.
And we need to tell them, teach them. See, there's a redness. So this is the which grade? It's a grade 1 red zone. If redness is there, it's grade 1.
See the last में जो रखे हैं सारे 5 जो है, these are the stages of decubitus ulcers. Okay.
Could you just show which places have bed sores again? Where typically?
So one is occiput, shoulder,
The scapular, no? This region.
shoulder area, and sacrum, both of the buttocks area, and below the area and the heel.
Got it.
It depends. If you're keeping the person this side,
Side
then the
like-
earlobe also need to be taken
Earlobe
care
also.
of. So there are various, gel pads nowadays they are coming. If you want to turn a patient utilizing these also we can do. Like you can
So
turn
you
the
want
patient
gel
into prone position also. Like ulta kar
The
sakte
patient
hain.
is in air, they will do the front posture.
They just
So
show
we can do
the
see
green
this
one.
is head support.
So she
This is
can,
the-
हाँ, यहाँ पे अभी नहीं हो पाएगा. But this how we can do is here this are been put and the patient is put on prone position and this will be the forehead and this will be the chin. So they can put to relieve pressure on this one also. Like इसको पूरा उल्टा कर दे तो यहाँ forehead आएगा, यहाँ chin आएगा. And जैसे हम मसाज पार्लर्स वगैरह में होता है ना, उल्टा कर दे तो there's a place. तो इसमें बस these are soft gel pads. So it doesn't put the pressure too much onto them, and then we can change it again. So 2 hourly positioning is mandatory for a person who is a bedbound or who is on long-term treatment on ventilator or whatever long-term care patients they need to have, because once this bed sore develops, the stages you are seeing how it reaches to the stage 4. Finally, that stage 4 is. We can take care of it in the early beginning
This is
itself.
stage 1, when redness is there, stage 1. And this is grade 2, and this grade 3 and grade 4. And this grade is after that edema also. If the patient is developing edema, we need to tell to take care more. Edema is developing.
So this is the positioning and the back care aspect, and along with that you can check for other things also. We have shown you this one bed sore.
One of the most important things is
Dressing.
the patient may develop contractures also. So we need to tell about the RON exercise, the finger exercise, and like range of motion
You can-
exercise,
yes.
shoulder and the upper part also.
This also, even this also, legs also need to be taken care of.
Four.
This is also a gel pad.
Silicone gel pad. So you can get like red head ring. It will come like round also. So in each area they have different type of gel pads that you can put around like this. This for heels.
You can put it here.
Heels also prone to get red, so we can keep it like this.
For how long we need to apply this?
Sorry?
For how long we need to apply this?
So in every position we are changing.
Every
the
position we are
of the
changing, then we have
So,
to change. Okay, we have to remove this and then other one. Like at times, at certain point we will turn the patient to left side, then right side, then for some time supine position.
And one of the most important,
Yeah.
like we are turning the patient to that side and we need to put a pillow.
Like if in case they are at home and they are told that time, also they need to be told that you don't have to buy this silicone gel pad. They can utilize the home items only to take care of the pressure ulcers.
And we need to take
So
care like
ऐसे आप यहाँ पर एक रखना,
pillow.
pillow रखो. वैसे we can teach them this way. So दोनों एक साथ में लगेंगे नहीं तो रगड़ेंगे, friction नहीं होगा.
If there is
Friction नहीं
no
होगा तो
like
skin
proper body
problem
mechanics
नहीं
is
होगा.
not there, patient will feel uncomfortable. So we need to make comfortable patient like this. Okay? There should not be any gap in between. So we need to take pillow like this.
Completely.
Yeah.
हाँ.
Okay.
Okay, so this way you can do the positioning and then you can.
And the edema is there, we can elevate like.
So this is the way we do the positioning of the patient to prevent the pressure ulcers. Okay, so this is also another important thing. Then there are other aspects also, like I told you, referral catheterization can be there. So that can also be like caregiver can be taught about how to do the referral catheterization, and like if they are on Foley's and all, they can change it at home also if they are not able to come from far off distances and all. So that can be done. The suprapubic cystostomy also they can be taught how to insert the catheter and remove the this one urine. And then there are enema administration, because these patients are also bedbound cases and old patients, elderly. They are also the risk of developing constipation. So enema administration, there are prophylactic enemas, pouches are already coming nowadays. So that can be taught how to insert it and give the enema. to the patient, and if in many times patient is not able to pass with the help of anemia also, so DRE has to be done. Digital rectal examination, along with we have to do the evacuation also. So that is also to be that can be done, and that can be taught to the relatives, because many of times it is very difficult for a caregiver to shift the person again and again to the hospital settings. So these are few things which are in our hands, which we can teach them, and they can also take care of these things at their home settings itself. Then ostomy care. You have seen the patient with ostomy and all. You might have seen. So ostomy care also nowadays in the hospitals with they are like doing some surgeries where the ostomy is being made. They are also having the ostomy clinics where the caregivers as well as the patient is being taught how to take care of their ostomies. For the normal young adults and all, it is easy, they can do on their own also. But then for the elderly, they need support, they need help. So the caregivers can be taught to take care of the ostomies, especially how to change the bags, and what all observation need to be made when they are doing the ostoma changing of the bags. So they are supposed to see the area around उसमें कुछ skin irritation, excoriation तो नहीं हो रहा है. Then how to fix the bag so that leakages can be avoided, because leakage से again क्या होगा, skin excoriation होगा. So that needs to be taught. And then we have one enteral feeding. Feeding is a more very important again. So if the good nutrition is there, the patient will be able to pass motion also. Then the overall things will be okay. But then if the feeding is also plays a very important role, because nutrition has to be there, it has to be built up. They are already frail, so they need to build up. They have to have a reserve little bit so that they can take care of their daily needs if they are active, if they are conscious, and if they are not, then also we need to take care of their aspects. So there is this mannequin has got this one. For long-term patients, what we are using? Are we using rice tube? We
If
do.
the patient
Yes,
is rice tube also, we need
Yeah.
to tell them how to feed the rice.
Yeah, if the person is, like it depends on how the patient is, for how many days patient they are with you. So if the patient is there for a brief period, we carry on with the rice tube feeding. But then if the patient is for long-term nutrition management has to be done, we do peg.
Gastrogastric tubes and
Yeah, NJ also we do, and peg also we do.
Like,
This is how the peg tubes looks. You have seen in your
you can do with the
setting in
gynostomy
the-
also, feeding gynostomy is also available.
Okay.
You can do with the peg.
So percutaneous.
So no need to put dressing over there in the bag, and we need to take care of that. We need to check whether skin excoriation is there or not, so we can feel like.
So these areas, any stoma, any opening is made, how to, what all to be observed during when we are dealing with these things, है ना? हमें पता है कि हमें एरिया ऑफ इंसर्शन देखना है, कोई इन्फेक्शन के साइन तो नहीं है, स्किन एक्सकोरिएशन तो नहीं है, तो ये सब देखने के बाद में
And mostly nowadays caregiver are using the sterlium, the hand scrub which we are using. We should tell them you should not use that sterlium in the wound area. It will irritate the skin and
wound
again
areas, basically. So these are nowadays feeding bags which are coming. Have you seen the feeding bags also? You might have seen, these are the feeding bags which comes.
So always the food will be in a fluid form. According to the patient requirement, calorie and protein, we can prepare the food.
So these are the
Mostly like
feeding
an
bags.
IV set.
है ना, IV की जैसे ही है. So feeding, it becomes easy with the gravity. It goes slowly. Okay.
We'll put the feed over here. We'll fill up here.
थोड़ा एक बार पानी डालेंगे. So this is यहाँ पे हम feed डालेंगे. We can what all you can give through this liquid
Liquid
diet.
diet, dals.
At times people think that only हम दाल मिल्क दे सकते हैं या कुछ भी ऐसे जो हम घोल के बना सकते हैं जल्दी वो दे सकते हैं, बट रादर what we tell patients also that but जो दाल बनाए सब रोटी बनी है आप उसको भी ग्राइंड कर दीजिए और उसका थोड़ा उस पर कंसिस्टेंसी उसकी इस तरह से रखिए कि वो इस ट्यूब से वैसे भी बहुत मोटी ट्यूब है which can go through it. है ना, वो देखिए वो मुंह से नहीं खाना पा रहे, उसको अंदर से फील आ रहे हैं उसको बोल में खाना है, तो इवन इफ यू गिव विद दिस वन दे फील हैप्पी. ओके कि हाँ कुछ तो दिया है, उसे बताना है कि हम तुम्हें दे रहे हैं चिकन, ठीक है इससे. So
Whatever food we are giving, we need to tell them. We are giving chicken soup, we are giving orange, so they can feel also.
So there are markings over here which tells us about the amount of amount of feed we have to give. So most of the time in the hospital settings we already have a nutritionist who plans the diet of the patient, and they tell us ki, okay, the diet has to be divided into three small feeds will be there, and 4 to 5 major feeds will be there. So accordingly, how much ml is also been told. So as per that, we can till marking, we can put this feed here, and then we will attach
What's the
this.
benefit of this bag rather than giving the syringe?
Shall we give the feed
We
with
can
the
put
syringe?
the syringe with the syringe also.
Uniform pressure?
More
Yes, sir, and we can
More calculated plus
gradually.
gradually it will go. So अचानक से
It will
fullness
not
of
bloat.
stomach नहीं होगा, bloating नहीं होगा. So gradually it will go attach करके.
We can use like this.
We can always set the limit also. कि हमें
Attach over here.
जैसे लोग used to हो जाते हैं चलना फिरना शुरू करें, उसके
Normal
साथ में
IVF
कई
से
लोग
करते हैं ना?
like onco patients and all who are on long-term treatment also are being placed peg tubes. So for them, if they're active, they are walking around, they will themselves regulate the speed of the feed because they will be moving around. But for the patients who are there on the bed only, we have to regulate it and we have to give it a slow speed so that it get, like patient doesn't have a fullness of stomach suddenly or bloating. ठीक है, तो वो नहीं होना चाहिए. That's why we regulate it slowly, gradually. We get the feeds. So this is also one of the important aspect which is to be taken care of. And then we have nasogastric tube placement and feeding. We can do in this one. We are not showing you, but you might have seen also in your
What
clinical
about
area.
like taking care of the NJ, nasogastric tube. What will teach to the patient caregiver?
NG tube पे जो होते हैं,
Nasogastric
patients,
tube.
what we will tell them?
What will tell them?
Important thing which we are supposed to tell them. Do not remove. That is okay. Yes, that has to be taken care of. And then another main important thing is that when the patient is being given feed, it should not be in a supine position. What will happen? Aspiration.
We need to tell them, otherwise they will vital it आके दे देंगे and they will next the next day.
So that is very important. So we have to teach how to give, and you have to take the re-demo from the caregiver also. And this in front of you so that they are confident. They develop confidence, then they go home and they are able to provide the care to the patient under their care. So that is, these are important things which need to be taken care of when we are providing care to the patient in the home settings or in the hospital settings also. I have tried to do my best in telling you what are the important aspects. Other than that, there can be n number of things. It depends from person to person with what complaints or with what problems they are. So our care has to be modified as per that, and as per the state of the person, whether he is conscious or unconscious or in what state they are, how much the cognitive impairment is there. As per that, we have to modify. So that these are the aspects. Tracheostomy care and tracheostomy suctioning is also been given. This scenario is right now we don't have that scenario here, so I'm not showing that. But these are the important things which we have discussed here is grooming and hygiene need to be taken care of. Where when we are providing the bed bath to a person, we have to especially take care of the folds. Okay, because they are most of the time they are often neglected. So that has to be taken care of. Skin care is required. Oral
Moisturizer
care.
and emollient, like we can provide. Otherwise,
Yeah.
friction will be there. It will get more chance to get the bed sores.
So-
So we can apply some moisturizer also.
Okay, and then pressure care. This care is of utmost importance because that is once it develops, it is very difficult to control it. So in the beginning, so every day if we start from the beginning itself, we check the patient's back or the sites, pressure sites, and we keep on providing the care as per like which I have told you that 2 early position change has to be there for these patients. So हम क्या early identification will be there and we can prevent it to go into the last stage. But then I hope if there is any doubt we can clear it with that. Hope you understood a little bit about how to take care of the patients.
And if the caregiver is unable to open the mouth of patient,
Yeah.
then how we will maintain oral hygiene?
There are, you can use that tongue depressor is there. You can teach them if that can be used with the help of that also they can do. Okay. And in the, like in the hospital settings also many times nowadays closed suctioning is also there. So with that also we provide, we do the brushing. Along with that the suctioning tube keep on suctioning out the collection also along with that. So everybody is not able to afford that, all those things at home settings, but there, that's why we tell you, okay, with the fingers and all, they can use a tongue depressor, with that they can hold down it, and then come and hold it.
Tell them trip the nails also.
Hmm.
Everything is required. As we require everything, हमें बाल भी बनाने हैं, हमें फेस वॉश भी करना है, हमें बॉडी को ध्यान रखना है, फोन ध्यान रखने हैं, हमारे नाखून अच्छे होने चाहिए. That gives you the positivity. So all these things, irrespective of being there on the bed or not bed bound, the elderly need to be taken care of because they might not be able to cut their nails on their own. So we are supposed to help them out with that also. So every entire head to toe, जो भी केयर होनी चाहिए, जो हम खुद से सोचते हैं कि हमें चाहिए, that is required for these patients, these elderly also. They also deserve that.
I think all of you need a big round of applause. Thank you so much. Thank you.